What is the root of the ureter? It is very important regarding exam point of the view. And ureter, they passes anterior to the medial edge of the vas major, and they separated from the tip of the transverse process L2 to L5 by vas major, and they cross into the pelvis at the bifurcation of the common iliac arteries in front of the sacroiliac point, and they runs on the lateral wall of the pelvis, and they runs in front of the internal iliac artery, and they passes under the uterine artery, and then it passes 1.5 centimeter lateral to the supravaginal cervix, and they cross into the bladder at the ischial spine, and they pierce the carpal and the broad ligaments. So what are the relations of the uterus? Here is ureter. Here it is the ureter. On the medial aspects there is the cervix, and on the lateral aspect there is the pelvic side walls. And anterior there is ovarian and testicular vesicles, and the right side the right colic vessels, and left side the left colic vessels and the uterine vessels. On the posterior, it in the caudal directions, the vas major, the common iliac artery, and bifurcation of the internal iliac arteries. Then it is crossed by the ovarian and testicular arteries, and in the caudal direction the right colic vessels and the ileocolic vessels on the right side, and the left colic vessel on the left sides, and the uterine vessels. What is the blood supply? It is from the branches of the aorta, the renal arteries, and the ovarian testicular artery, internal iliac artery, and inferior vesicular artery. The nerving, it occurs at three sites. This is very important, and it occurs at the junctions with the renal pelvis, the pelvic rim, and the ureteric orifice. The common sites of the ureteral injury during the surgery. This is a very important for MCQs. There is a injury site. It usually occurs lateral to the uterine vessels, in the tunnel of the caudal ligament, and the base of the infundibulous pelvic ligament, and as the ureters across the pelvic brim at the ovarian fossa. The lateral pelvic wall is just above the uterosacral ligament. Then let's move to the bladder. The bladder, it is the extraperitoneal and is intra-abdominal in the children less than 3 years, and ureteric orifices, they are 2.5 centimeter apart, and trigone is a triangular area which is bounded by the ureteric orifices and the internal meatus. So the relation on the anterior side, there is a symphysis or pubic symphysis. On the lateral side there is the levator obturator internus. On the superior, the peritoneum and intestine and the uterus, and on the posterior, the rectum, the vasa deferens, and seminal vesicles, and the vagina and cervix. Now the urethra. In the females, it is about 3.8 centimeter long, and it lies 2.5 centimeter behind the clitoris. In the males, it is 25.4 centimeter long, and it is divided into three portions. And the prostatic utricle, it opens into the collicus seminalis, and is a blind tract, and is the remnant of the paramesonephric duct, and it is equivalent to the vagina. It has the spiral grooves on the inside. And the portions of the male urethra, it is the prostatic, the membranous, and the spongy. Prostatic posterior wall, it bears the urethral crest and the uh, pros- prostatic sinus, and the membranous located in the deep perineal pouch, and the contains the external urethral sphincter and the narrowest part of the urethra, and the bulbourethral glands, and enters here. The spongy, also known as the cavernous or the penile portion. Then the epithelium, it changes between the transitional near the bladder, the stratified columnar, and the stratified squamous near the external urethral orifice. It contains the mucus secreting urethral glands. The urethral sphincter, they has the two parts: the internal, which is located at the junctions of the urethra and the bladder, and the composed of the smooth muscles, and under the autonomic sympathetic control, and from the inferior hypogastric. In the females, it is not automatically distinct. All those smooth muscles and fibers are still present and external, located at the junctions of the urethra and the bladder in the females and after the prostrate in the males. It is composed of the skeletal muscles and the under voluntary control by the perineal branch of the parental nerve, but not exclusively. Now moving towards the male genital tract, the external genitalia consists of the scrotum, testes, epididymis, the vas deferens, the penis consisting of a pair of the corpus cavernosa and the corpus spongiosum, and internal genitalia consists of the seminal vesicles, the ejaculatory ducts, the prostate gland, and the bulbourethral gland, which is the Cowper's gland, and the scrotum, such as pigmented, and the which is rough. And it contains the median longitudinal raphe, the sebaceous glands, and the dartus muscles, and it is divided into two sacs. The temperature is 2.5 degree lower than the body temperature. Epididymis, it consists of the head, body, and tail. It measures 6 centimeter long, and it is lined by the ciliated epithelium, and the passage of the sperm through the takes 8 to 14 days. And the vas deferentia, it measures 45 centimeter long and joins the spermatic cord and connects to the epididymis, and similar length to the femur thoracic duct and the spinal cord, and the distant from the incisor to the cardiac end of the stomach. The seminal vesicles, they are irregular shaped sacs and they lie between the base of the bladder and the rectum, and the measures 5 centimeter long, and the functions, they are the reservoir for the spermatozoa and secretes the nourishing fluids for the sperms. Ejaculatory ducts, they measures 2.5 centimeter long and eject the sperms into the urethra and connects with the vas deferens to the urethra. The bulbourethral Cowper's glands, they are situated at the root of the penis and the pea size. Testes, the left testis, lies lower than the right and oval shaped, and it is measures dimensions are the 55 into 30 mm and weight is 10 to 15 gram and volume is 15 to 30 mm. It has the three layers, the tunica vaginalis and the tunica albuginea and tunica vasculosa. The functions, it produces the spermatozoa and produces testosterone. Consists of the two types of the cell, the Sertoli and the Leydig cells. The structures is it has 300 lobules, and each lobule has 1 to 3 seminiferous tubules, and each tubule is 61 centimeter 2 feet long. The seminiferous tubules, they anastomosis at the reed testes. The seminiferous tubules, they line with the germinal epithelium and they make up 90% of the testes. They have a basement membrane that acts as the blood barrier. The testicular artery anastomosis with vas testis. The vas artery is a branch of the inferior vesical artery. The lymphatic drainage, the para-aortic lymph nodes, and the cervical nodes. And the nerve supply is by the T10. Development, the fetal life, 3 months they reaches the iliac fossa, 7 months they transfers in guanal canal, and 8 months situated at the external ring, and 9 months descends in the scrotum. And embryological remnants, appendix testis is the remnant of the paramesonephric duct, and the appendix epididymis is the remnant of the mesonephros. Sertoli cells, they situated with the seminiferous tubules and the nourish the spermatozoa and produce inhibin and the estrogen and contains a follicle stimulating hormone. The Leydig cells, they are situated between the seminiferous tubules and produces testosterone, and they contain the luteinizing hormone receptors. Prostates, they measure 4 into 3 centimeter and the pyramidal in shape, and the relations includes here, if it is a prostate, on the inferior side there is external urethral sphincter, anterior there is a pubic symphysis and retropubic space, and prostatic plexus and the puboprostrate ligament. On the lateral side there is the levator ani, and it has two capsules, the true capsule and the false capsules. The false capsules, which is extraperitoneal fascia, continuous with the bladder and the denon-velar fascia. Blood supplies the inferior vesicular artery, and the prostatic plexus, they lies between the two capsules of the prostate. They receives the dorsal vein of the penis and drains into the internal iliac veins and the valvus vertebral vein of the Pearsons. Now the next step is topic is the female genital tract and external genitalia. They includes collectively known as the vulva, and extended from the anteriorly mons pubis, posterior to the perineum, and lateral to labia majora. Consists of the mons pubis, labia majora, labia minora, vestibules, and the clitoris. Then the mons pubis is a part of the fiery tissue that lies above the symphysis pubis. Labia majora that extends from the mons pubis to the perineum and the locus to the scrotum, and they contains the hair-bearing skin, sebaceous glands, and the smooth muscles, the tunica dartos, and the nerve endings pre and the corpules, the rufinase, fasciitis, the Merkels, and the Meissners. And the nerve supply includes the iliohypogastric nerves, ilioinguinal nerve, genitofemoral nerve, posterior femoral cutaneous nerve, and the pudendal nerve. The labia majora, it is the hair, it is minora. It has hair, it is the hairless skin fold and give rise to the prepuce, frenulum, and the fourchette, and contains the sweat glands and the sebaceous glands. Next is the vestibule. It is the area enclosed by the labia minora, and it contains the urethral orifice and vaginal orifice, and the blood supplies the azygous artery of the vagina and the pudendal artery. Next is the clitoris. It contains erectile tissue, consists of a glans, a shaft that is attached to the pubis, and paired crura that are attached to the inferior pubic rami, and the ischiocavernous muscles overlie the crura of the clitoris and originate from the ischial to the rostri. Bulbospongiosus, also known as the bulbocavernous, the muscles originates from the perineal body, inserts into clitoris shaft, and overlies the vestibule bulbs and the Bartholin gland. The Bartholin gland, a pair of the glands that lie between the perineal membrane and the bulbospongiosus muscles at the tail end of the vestibular bulb and deep to the posterior labia majora. It is pea-sized and the duct is 2.5 centimeter long, and it drains at the 5 o'clock and 7 o'clock uh, position between the hymen and the labia minus. Then the introitus, it is a vaginal opening and situated in the vestibule and covered with the hymen, and remnants of the hymens are called the carnunculi metiforms. Vagina, the vagina orifice is demarcated by the hymen, and the length anterior wall is 7.5 centimeter, posterior wall is 10 centimeter, and length is proportional to the height of the individuals, and the cervix, it projects into the interior part of the vaginal wall. It has no glands, it's kept moist by the cervical glands and the seepage of the fluid from the blood capillaries. The relation of the vagina, the lateral, there is levator ani and the pelvic fascia. Superiorly, there are the ureters, and posterior, there the anal canal rectum. Then the borders of the vagina, the peritoneum covers only the posterior part of the 1/4 of the vagina. The ureters, they lies above the lateral to the fornix and 1.5 centimeter away from the cervix. The blood supply, it includes the uterine artery, the vaginal artery, internal pudendal artery, and the middle rectal artery. And the lymphatic drainage, they are the upper 1/3 of the vagina. They are drained by the external iliac nodes and internal iliac nodes. The middle third is drained by the internal iliac nodes, and the lower 1/3 is drained by the inguinal nodes. And then the Gardner's duct cyst, it is the mesonephric remnant of in the vagina, and the vaginal fluid pH is 4, high potassium content, low sodium content, and remains alkaline 6H post coitus. And the vaginal wall is composed of the four layers: the inner squamous epithelium, the connective tissue, muscular layer, and connective tissue. And epithelium is arranged in the pores. Vagina, they contains the Doderlians, bacilli, and nerve supply is by the sacral plexus. So next is the uterus.